Hi guys, welcome back to my YouTube channel. I am Nursefvenomi if you're just seeing me for the first time, and in this video I'm going to be talking about specialties in nursing. What is a nursing specialty? A specialty basically is just you going back after school, after getting your degree, going back to further in a particular field. You write exams, you get training in that particular field, and then you are certified to work as a professional in that field. So now that I'm done with university, I am a general nurse, and if I go into the hospital to work, they can send me to any ward possible. But if I go further to specialize in renal nursing or anesthetic nursing, there's no reason why I'll submit my CV and then they'll be sending me to another place that is not where I specialize. Why specialize? Because specializing gives you an upper hand. Salary-wise, the salary of a general nurse is nowhere close to the salary of a nurse that has specialized. The working hours are different. I think specialty is definitely more flexible than the normal bedside nursing, depending on where you specialize though. And also the hospital values you more. Now that you have extra certificate, now that you are trained to do more than the scope of just a general nurse, the hospital values you more. So let's go straight into the specialty. The first one I'm talking about is aesthetic nursing. I'm sure a lot of people have not really heard about this. I am not talking about nurse anesthetists in the theater. No, I'm talking about aesthetic nursing. And these are the guys that perform and help patients that are undergoing cosmetic procedures like facials, people that go for hair transplant, BBLs, breast augmentation, name it. They are trained to perform as well as help in the recovery of patients that undergo those procedures. So if you have an interest in that, there's one American channel that shows all these cosmetic procedures. There are two American surgeons that used to do this thing very well. I don't know the particular show on television, but I'm sure a lot of people know what I'm talking about. So if you see yourself watching those videos that you're interested in that field, specialize in aesthetic nursing, get your certificate, and yeah. So the second one I'm going to be talking about is renal nursing. Now, this is a field that I find very interesting. I've thought about going into it, I'm still doing my research, but renal nurses are nurses that take care of patients with kidney diseases. So patients that are undergoing dialysis, patients with kidney diseases, patients at risk of having kidney diseases. You don't walk inside the hospital and see a renal nurse. They are always in a specialized section. These are the nurses that take care of them. They help perform dialysis, take care of the patient throughout the dialysis, and then just help educate the patient on their conditions and different things actually. But these are renal nurses. They are definitely not paid the same salary as a general accident and emergency nurse. Now we're going into the theater. So when you walk into the theater, there are two main specialized nurses inside there. The peri-operative nurses, and these are nurses that are sterile inside the hospital. So what they do is that they basically make sure that the surgery goes on perfectly well with no infection. So they make sure that the instrument they use for the surgeries are clean. In fact, not clean, sterile, like above clean. The wound sites, even after surgery, they make sure that everything they use for the surgery is sterile so that the patient does not experience wound breakdown or have infections after surgery. So those are the clean guys, like the very clean guys. They work hand in hand with the surgeons, and you basically see them standing during surgeries because they are sterile. They cannot sit down anywhere, they cannot walk or go anywhere just like that. So those are the peri-operative nurses. The second batch of nurses, specialized nurses in the theater, are the nurse anesthetists. So these guys are trained. Oh my God, if you see a nurse anesthetist work, like if you are watching them work, you just be like, what? Because I find it so interesting. But it also feels hard in my head. I have not sat down to say, oh, this is where I want to go to, but it's definitely something that is in my mind. In case you don't know, these are like the highest paid nurses across the whole world. Once you specialize in this field, no matter the country you are in, you have the highest paying job, So these guys are not sterile like the peri-operative nurses. So they can sit down, they can move around. But what they do basically is that throughout the surgery, they help you stay calm. They help your muscles stay relaxed throughout the surgery. They make sure that you don't feel pain throughout the surgery, and they also make sure that you are alive throughout the surgery. Because during surgery, when they knock you out, you're like, should I say half dead? They make sure that your vital signs are still peaking, that you are alive and well throughout. And then if there's any like imbalance in the vital signs, you just see them walking like, oh no, those guys are good, and then the balance comes back and you are good. So those are the two nurses. I think anesthetic nurses and peri-operative nurses work on call. They don't work like normal shift, so they get that call allowance too. The fourth one I want to talk about are the cardiac nurses. These are nurses that work with patients that have cardiovascular conditions, heart, blood vessel, blood, whatever. As far as it is cardiovascular, you see them in that field and they are trained to work with those specific patients. The fifth one I want to talk about are the dental nurses. So these nurses have gone ahead to specialize in taking care of patients with dental issues, teeth, anything relating to the mouth. You see them in dental clinics, you know. So if they're in a clinic, you can just imagine that they are closing very early. Clinics don't stay as long as, you know, the normal shift wards that you work in, but they work in the clinic hand in hand with the dentist. The other ones are the ophthalmic nurses, and these are nurses that work with patients with eye infections, you know, all these glaucoma, style. If a patient has an accident and then it has to do with the eye, they go to that section. If the patient has an accident and it has to do with the mouth, they go to the dental section, you understand? So these people are specialized. Wherever you go to work, they are going to move you to that particular clinic. Do you understand what I'm saying? Then we have pediatric nurses. I am sure a lot of people know about these guys. They work with children, and I think they basically work with adolescents. So from 29 days up until 18 years. I'm not particularly sure, but I think it's hospital policy. They work with adolescents and, you know, surgical cases, emergency cases, medical cases. As far as they are within those age range, you have specialized to work with those particular children. We have neonatal nurses. So these nurses work with children basically from age 0 to 28. Neonatal nurse has a different work field. You know, they are more sterile than the pediatric nurses. If you go into their work field, you most likely see incubators, you see that blue light for jaundice, you know, and you cannot just walk in with your shoe. They always say remove your shoe at the beginning. So they are trained to work with those tiny babies and do procedures, all those delicate procedures. So if you see that and you love that, go into it. There was a time that I was thinking about going into that, but I changed my mind, man. It's a lot of work. I can't. Anything children, man, I'm running away. Then we have labor and delivery nurses as midwives use. And these nurses basically work with women that are pregnant, women that are trying to be pregnant, women that are pregnant, women that are in labor. Like, they basically take care of women, see them in the maternity section of the hospital, and then they just help with not only labor and delivery, but I think in Nigeria, if you are in labor and delivery, you also span across antenatal, taking care of adolescent girls, reproductive health issues, and basically like that. Anything that has to do with the woman, pregnancy, delivery, you will see a labor and delivery nurse there. And we have oncology nursing. So these are nurses that are trained to take care of patients that have cancer, any form of cancer, or patients at risk of having cancer. So breast cancer, cervical cancer, prostate cancer, you name it. As far as it has to do with cancer, you see them there. And I think they are trained to give chemotherapy and take care of patients throughout the chemotherapy process. So these are the guys that have strong hearts. If you go into the hospital and then you see cancer patients and you have a heart to, you know, care for them throughout, because most of them are in, like, is it palliative care, where they are, you know, they are dying and you're trying to provide a peaceful death for them. And, you know, at that case, you're not only taking care of the patient, you're taking care of the patient and the entire family members, because it comes with a lot, not only the financial burden, psychological burden, emotional burden, all those things. So I feel like if you are going into oncology, don't just think about, you know, chemotherapy and taking care of patients with cancer. You have to have like a soft heart to be able to take care of a whole community, the whole family. So yeah, that's another very special field. Then we have the psychiatric nurses, and these are nurses that work in the psychiatric department in the hospital. They take care of patients with mental health disorders. And if I say mental health disorder, I am thinking about somebody that is mad walking on the street. Then you need help. You need help. But Even me sitting here, even me as I'm sitting here, I can have my own mental health condition, right? So they take care of people with mental health issues, and then they just help to improve their function, promote health, and just help them generally. It's a lot. It's a lot. See, as I'm saying it, the day they posted us the psychiatric unit, that was when I was like, thank you, Lord, because now I know for sure that this is not my calling. But there are people that love it, and it's a very interesting field. Actually, you just have to have like a strong heart to be able to relate with those guys, and knowing that they can switch on and off like this. So yeah, that one is something that takes really good passion. In fact, every specialty here takes passion for you to be a master at it. We have one very interesting field that people don't really talk about, but I am finding so much interest in it, and this is radiology nursing. Do you know that if you walk into the radiology department, where you have all those ultrasound, MRI, CT scan, there are nurses that specialize in radiology that are fixated in that place. If you remember in school, when they were teaching us about all these diagnostic procedures, CT scan, MRI, they talked about nurses' responsibility before, during, and after. So if you specialize in radiology nursing, those responsibilities before, during, and after is what you are going to do for any patient that comes to your clinic. And then all these specialties, especially things like aesthetic nursing, you see this radiology nursing, labor and delivery, you specialize in those things. I think you have the right to open up a clinic. So, like echo lab, scene lab, if you're a radiology nurse, you can open up that kind of clinic. And then if you're an aesthetic nurse, you can also open up an aesthetic clinic. So I think this is a really good field for people that have the passion for it. It is paying well, as far as I know, and then the working hours are more flexible. Nursing educators, and these are people that you normally see in school. Your lecturers that taught you that nurses are nursing educators. So if you find that teaching people is what you love, then you can 100% be a nursing educator. Please don't let anybody tell you that if you specialize, you lose your nursing skills. Please, thank God. Please, I want to lose those skills yesterday. Like, that's how bad I don't care. But if you love something, if you have passion for something, don't let anything anybody says shift your mind from that thing. If after going to school for 5 years and specializing in, and let me say doing masters in public health, whatever, you still have a calling for teaching, please go back and teach. Go back and teach. That's where you will find yourself, and that's where you'll be happy. And nobody cares if you lose your nursing skills. Please, I'm taking this very personal because the way I want to run away from this bedside, more. So those are nursing educators. They basically train nursing students, and I think that gives you a lot of joy. If you're passionate for education and you go into schools and you train people, and then you see them in how many years being something so great, it should give you so much joy. Don't let anybody say until you go to hospital you're not doing well, please. We have geriatric nurses. So you remember I told you that neonatal take care from 0 to 28 days. Pediatrics take up from that 29 days till adolescence. Then geriatric nurses, what they do is that they take care of aged people, old people. So if you like that, caring for old people, caring for old people takes a lot, You need to be able to move them, do the activities of daily living like bathing, brushing, taking care of their hair and everything. As a nurse, if that is your passion, then please go into geriatric nursing. And there are cruise ship nursing. If there's a ship, then there must be a form of medical aid. So if you specialize there, or if you go further for training and get certificates, you can work on boats, and that will be your field. Like anything boat travel, you'll be inside the boat, under first aid care while you are on the boat ship. Then let's talk about school nurses. These are people that you see in school. So remember when you were in primary school, secondary school, you had like a place called, is it sick bay or clinic, whatever it was called in your school. The nurse that is there, the nurse that you saw there when you fell down or when you fainted or when you pretended to faint, that person is a school nurse. ICU nurses that work in the intensive care unit. One ICU nurse said that ICU nurses are nurses with the third eye. They are taking care of patients that are critically ill. So they have to be able to, pick up anything that goes wrong. There are patients that are in the ICU that cannot breathe on their own. They are hooked up in mechanical ventilators. You need to be able to, monitor those patients. Okay, then we have accident and emergency nurses. So in every hospital there's an accident and emergency department, and if you're specialized and you have extra certificates, you can be qualified as an accident and emergency nurse. Yes, I know that most of the nurses working there don't have that extra certificate, but I promise you there is always a nurse that has that accident and emergency certificate. Maybe they will make the person like a leader in that place, but is you going to get extra certificates and then working in that very, very intense field. I don't know why anybody will be doing accident and emergency nursing, but definitely it's passion. It's just passion. Nobody can push you into that kind of thing. Public health nurses are the people that have, maybe done their masters in public health after school, and you most likely see them in NGOs working with, all these community organizations. Basically, their scope is just dealing with the public and community and making sure that they have access to healthcare and all those food, water, everything, and make sure that they are prevented from all these diseases, malaria and everything. So a public health nurse is someone that is interested in the health of the community. And you can pick a particular field. You can pick like sickle cell, you can pick like HIV, and just work hand in hand with NGOs, all these WHO, NCDC, and yeah, that's where you see them. We have nurse administrators, and these are people that have gone to also, specialize or do their masters in nurse administration. And you most likely see them in the hospital, but working in offices. So like your CNS or CNO, whatever it's called, nursing, all those chief nursing officers, and people working inside the hospital, but not on the bedside. Like they work inside offices and then they deal with paperwork. These are nursing administrators. And you can also go further into politics, leadership,